For our first speaker to open the conference, it's a great pleasure to present Professor Anna Hansell. She's a British physician who is Professor of Environmental Epidemiology and Director of the Centre for Environmental Health and Sustainability at the University of Leicester. And quite recently, she was appointed chair of the COMEP, that's the Committee for the Medical Effects of Air Pollution. I have great pleasure in inviting Professor Hansell. Thank you.
Right, I have a, yes, it's working, that's great, lovely. Thank you very much for inviting me to speak. I have to make it clear I'm speaking in a personal capacity and not as the chair of COMEP today. And a couple of other observations. I'm going to talk mainly about air quality and try and draw some of lessons that are emerging from the pandemic, and also trying to work out two screens and how I'm going to show you on, I may be doing some running about, so that's good. Okay, so I think the first point is, given my title, Lessons from the Pandemic, we're not actually out of the pandemic yet. And, you know, we've got another winter to go. We could have possibly even a couple of years of this going up and down, but I'm certain it won't be as bad as last year. But there's some nice charts I've got from Our World in Data, and I will come back to those. But pointing out this is a global problem, and I think that covers many of the environmental issues that we face. The first section I'm going to talk about air quality in lockdown, because I think looking at what happened when we were in our homes and not traveling as much can be quite instructive. And the initiative for that really came from April last year. And I was contacted by the One Show and asked to talk about, wasn't it wonderful that the air pollution had come down, even though everything else was terrible. So, so we had a very interesting conversation because the NO2 has been coming down, but there was, it was that very fine still period. And we had air quality forecasts, episode forecasts, at the same time for particulates, which was sort of quite interesting, but the One Show weren't interested in the particulates, they were interested in the fall in NO2. So in my group at Leicester, we decided to look at what had actually happened during that first lockdown using the AURN monitoring network. So we looked at the time of the strictest restrictions, which were March to May, and we looked at the criteria pollutants, NO2, ozone and PM2.5. And because there'd been weather affecting it, we also did some business as usual modeling, saying, you know, if the emissions, you know, our normal anthropogenic activities had continued, what would the air pollution have looked like? And we also had a look at the road traffic levels over that time period. And some headline results. So overall, there was around about a 70% reduction in traffic, much less in heavy vehicles than in road transport. But if you looked at what happened from the monitoring stations, there was a fall of around about 40% overall in NO2. It was quite variable. It was obviously greater by roadsides than it was in some of the background sites. And for PM2.5, there was a reduction, but it was more modest. It was around 16%. And if we looked at ozone, ozone had actually gone up slightly, which I'm sure relates to the fall in NO2. And in our business as usual models, we made some predictions that our NO2 and ozone would have been more or less similar, but the PM2.5 episodes that were predicted weren't quite as bad as they would have been. So there are some graphs here. I'll have to apologise to people on this side, but if you can look at the sort of shading, light purple shading, that's showing you PM2.5. That's 2017 to 19 on the ranges. These are the predictions in these sort of black dotted lines at the top here And underneath that, there's a darker sort of blue-purple line, which represents what we actually saw. And this is an urban background site in London that's fairly representative. So we could see that the levels were fairly similar to what they were in the previous 2 years, but ought to have been a lot higher if we hadn't had the reduction in traffic. Another representative site on the NO2, fairly similar sort of purple, light purple shading is 2017 to 19 ranges. The little dots are the business as usual model. And then at the bottom, this darker purple line is what we actually saw. So again, this is fairly representative of what we saw in the urban background sites. So there was a reduction in the NO2 and it was more marked by roadside. So what can we learn from this? What lessons does it give us? Well, it says that if you reduce road traffic emissions, you're not going to solve the problem of air pollution. So I think we knew that, but it's very interesting to look at this natural experiment and say, this is what it's telling us. And there have been a number of other models that have been produced. Roy Harrison at Birmingham produced nice models looking at de-weathered trends, which are also quite a useful comparison. But I think it does tell us that if we're going to make progress on air quality, we've got to think across the whole range of sources. We can't just look at just traffic and say, if we solve traffic, we've solved air pollution, because we haven't. And the other thing that we thought would be very helpful is knowing more about VOC emissions, to be able to look at this NO2 NOx issue. And there just wasn't the data to be able to look at that in our models. So we published this paper early this year in Environmental Pollution. And there have been some nice discussions of this. So this is by Paul Monks in The Conversation. So Paul Monks is the Chief Scientific Officer in BASE. Very nice piece. Is this a glimpse of a low carbon future? Is it a glimpse of what the air pollution might look like with electric cars, for example? So there are some inferences, but there's less good news in terms of what the greenhouse concentrations were in 2020, because they didn't drop, but they're still going up. Arguably, they haven't gone up as much as perhaps they would have done without the lockdowns. Oh, we seem to have lost presentation. I can talk to that side. Okay. Do you want me to go? Yeah, I'm back. Okay, that's great. Thank you. So I think there's some interesting lessons. I think we could also look at the other lockdowns and see what's happened overall. Potentially it gives us some hard information about what life might look like with changing transport patterns to tackle air pollution. So I'm going to move on to air pollution and COVID, and that's been a very live issue since last year. I was hoping to show a video here, but I think these I've got Europe and China, just showing the way in which the NO2 levels have changed over time. There are some nice satellite data maps that show how the emissions and NO2 levels as monitored from space look. All good, great. We've got the European one going. So there were falls. This area in Italy, probably some of you know, is one of the worst, highest polluted areas in Western Europe. And we import quite a bit of air pollution from these areas over into the UK. So it was observed, and there we go with the Chinese air pollution, thank you. So really nice videos. So these are the early part of the pandemic last year. Okay, and it was observed that, we had these high air pollution areas in northern Italy and in China, and that was where the COVID cases, the first outbreaks were marked and quite severe. So immediately people drew an association and said, it's the air pollution that's driving the problem. And I was actually approached by a journalist in Seattle, completely out of the blue, saying, "What do you think of this hypothesis?" And I said, "That's quite interesting." And then I said it's quite a difficult question. That was a bit later on in the Guardian, who are also very interested in this issue, because, you know, obviously if we've got a pandemic, we need to look at the mitigation factors and say, you know, how important is this? Is driving down air pollution going to be one of the measures we use to tackle the pandemic? And a number of papers were published looking at correlations, saying, you know, the air pollution levels were higher, which happened to be in some of the densely populated cities with deprived areas and ethnic minority populations, which may have also accounted for the high levels, also tended to be travel hubs, but those were the areas that also had high air pollution levels and had high COVID-19 deaths. And this is epidemiology talking about some of the perils of correlation. So correlation, it sets up a hypothesis. It doesn't tell you what the answer is. And you know, then you're sort of scratching your head. So you move on from that in an epidemiological perspective, usually to doing area level studies. So that's usually the next step, because they're fairly easy to do. And this was a time when a lot of the information was coming out in preprints, so medRxiv and bioRxiv, and it was just impossible to keep on top of all of the studies that were coming out that hadn't been peer reviewed. And they kept changing as well. So you'd look at them, and then the next week, you know, they're very good studies, very good authors here. But this study from Harvard, on the left-hand side, the first iteration had a much higher association between air pollution and COVID than the next one did. And it was slightly different from the study from Emory, which is near in Atlanta, near CDC. And they showed slightly opposite findings in terms of which was statistically significant in the air pollutant. So very confusing, and neither had been peer reviewed. So very tricky. And we got to the position that the medical press said, stop, just slow down and let's get some rigorous science here and get a good evidence base for what we're looking at. So this was the European Respiratory Journal. This is around May time last year. And then we had this one in the BMJ saying imperfect incentives. So there was this incentive to rush things into press that probably would have done better with a little bit more thought. So taking a step back, just thinking about air pollution. I mean, air pollution is the fourth risk factor for mortality worldwide, responsible for about 7 million deaths worldwide. We know it affects many parts of the body. So these in bold are the global burden of disease, and these are other, not in bold, are other potential implicating areas of the body. But of particular interest is that respiratory disease morbidity, respiratory disease mortality, pneumonias, respiratory infections can be affected by air pollution. So we know that already. So if we're thinking about a new respiratory infection, it seems unlikely, I think, that it won't be affected by air pollution. So the question is, how much and when's the exposure important if you're thinking about mitigation? And long-term exposure does predispose to chronic obstructive pulmonary disease, COPD, and cardiovascular disease, also diabetes. Some papers suggest there's a link with obesity. So all of these are risk factors for more severe COVID-19 and are a very plausible link by which air pollution might be impacting on our COVID-19 severity rates. And then in terms of short-term exposure, does that have an impact on infection? So there have been various theories about that. Is the virus carried on particles? Not much evidence that that's a strong mechanism at the moment. Is it causing some sort of lung inflammation? That's being investigated at the moment. And there's some really interesting sort of specific mechanisms around the way in which air pollution interacts with the lung cells And it seems on some of the initial evidence to upregulate the ACE2 receptor, which the SARS-CoV-2 virus binds to actually get into the cells. Whether that's enough to increase infection rate is still very much under investigation. And the other issue is, if you've got inflamed lungs to begin with, is that going to make a COVID-19 infection more severe? So there have been a number of reviews on this, but it's still early stages on the studies. And various types of evidence have been looked at. This is the most recent review, which has been conducted from Imperial College London. It's a very nice report available on the web, and long-term exposure to air pollution in the studies that they've looked at. So they've tried to be systematic in this and look at all of the studies, does seem to increase the risk of severity of hospitalization in people who are infected. Not every study's showing that, but looking over the totality of the evidence. It's not clear about this link between infection and COVID, infection with SARS-CoV-2. The mechanistic lab studies are ongoing. There's very few that are actually in print yet. There's some that are available as preprint. The particles don't seem to be a big factor, but still being looked at. And looking at this short-term exposure and COVID is actually really tricky, as you're dealing with an exposure that you haven't got a very good handle of, because it's all changed anyway during the pandemic. People's movements and exposure indoor outdoor has changed. You've got vaccinations now, you've got different variants, you've got different household structures affecting spread, and then you've got some genetic factors that we know are important, and it's possible that other previous common cold infections caused by coronaviruses that are not SARS-CoV-2 might also play a role, and they might be protective. So there's a lot of different factors to think about. There is a really nice study that came out yesterday that I think is one of the best studies to date, which is in Spain. And what they've actually done is recruited people into a cohort, so a group of people followed over time, and they've looked at their antibody tests for infection and linked that with air pollution in the preceding 2 years. And what they're seeing is something that's consistent with some of the other types of studies that have been done to date using routine administrative data, but it's round about this sort of 7 to 10% increase per microgram of PM2.5 or 10 microgram of NO2. So it's all around that sort of level, which is what I might expect from looking at other types of infection. You know, you see the small increased risk, but it's across a population level, so it becomes important. So I'm going to finish set of slides by making some really quite personal observations about epidemiology and public health in the pandemic. So I'm a public health doctor by background, and let me say anyway, I will say it when I come on to some of the issues that there are. So I said to this slide, we are still in the pandemic. So I've got a graph here. The United Kingdom is on case rates. So these are our case rates from last March time. And I've got the European Union average. I think some of you will know that the Netherlands and Belgium are about double that at the moment, and then France and Spain are sort of down the bottom, and we're in the middle. If you actually look at the, where we are today, I think Belgium and the Netherlands have just shot up above us. United States is down at the moment. It might go up after Thanksgiving, and we're just entering winter time. So I haven't put in the low and middle income countries because they look quite low on the graph there, and it's actually, we don't know how much infection there is because it's not being systematically tested. But like any public health problem, most of them are global. They don't respect borders. And in the pandemic, I think it's a real mistake that we haven't moved fast enough on getting vaccinations out to developing countries. It's not humanitarian aid, it's biosecurity and it's border security. And if we have high rates of infection in other areas, then we're driving the possibility of new mutants. I mean, it's really not in our interest. And I think there's a good analogy we can make. I won't show the videos again, but thinking about air pollution, I mean, we've got Europe here, we've seen the air pollution moving. I mean, the air pollution is not respecting borders. We're importing air pollution from Europe and exporting it to Scandinavia, for example, because the way the wind blows. We can't solve these problems without having a coordinated approach. So it's not just solving the problem in our city or solving the problem in our region or our country. We've got to work internationally to be able to solve the problems. And, you know, climate change is another fantastic example of that. You can't just, you know, you need to work locally, but you can't solve it unless you work globally as well. Oops. Let's go on. So again, another personal observation in this is the weekly confirmed COVID deaths in the UK. It's what they look like. Different metrics you can use, but they show a similar pattern. And I think probably now's a good time to just offer condolences to anybody who's lost somebody in the pandemic. There will be people in the room. My aunt succumbed, went into hospital with something else and picked up COVID last Christmas time, which was very sad. I think one of the issues I've got at the moment is that there's been a pretense that the pandemic's over, and we're getting round about 700 to 1,000 deaths a week still in this low tail here. And that's been going on for about the last 2 months. And that sort of got me thinking, because the figure that we usually give out for number of deaths for air pollution is around about 40,000. So it's, you know, it's not dissimilar. It seems to be a sort of level that people can say, well, you know, I don't need to think about it. And I think that's a real challenge. The pandemic hasn't gone away. Air pollution hasn't gone away. And I think there's a lot of importance to stress on keeping what's invisible visible and saying, you know, we don't accept this. And I think for air pollution, there's some very nice initiatives. So this is the Breathe Life 2030 initiative, which was started in 2016 by WHO. There's a very nice website and infographics with that. And there's also the book by Gary Fuller. Some of you may be aware of Gary Fuller, who writes columns in The Guardian, and he's written a book about the rising global threat of air pollution and what we can do about it. Lovely sort of discussion of the you know, the history of air pollution, and just helps, you know, it's a very readable book, but it helps think about the context. So public health messaging, so that's been quite interesting in the pandemic, in the British way of saying interesting. I just remember last year, I mean, it was horrible, wasn't it, last December? It was, you know, as a public health doctor, you're sort of sitting there from, you know, around about the half-term time, thinking this is like watching a slow train crash, because there's no problem, we're not going to have a circuit breaker, we're, you know, it's fine, the infection levels are doing this, we'll be fine, it's fine for Christmas. Oh no, it's not fine, we've got to cancel Christmas, we've got a surging mutant virus. And I think using fear in that way has rebounded, and anyone who has anything to do with public health messaging knows it's a very limited tactic you can use. And I think, you know, people got very afraid, and then they thought, oh, that's all over now. Thank God for that. It's, you know, it's Freedom Day in July. I think they're linked. And the other problem we've still got, I think, is at the end of the first lockdown, we had our transport secretary telling people to avoid public transport. And I don't know what your impressions are, but mine are, traveling on public transport, is that the levels are still not back to what they were, even though the road traffic levels are. So I think that's a problem. Public health people have been saying fear approaches aren't good for us. They've been publishing it, but obviously not getting the messages to the right people. So this I'm going to leave on finish on this. This is an example of good public health messaging. So I strongly recommend this report if you haven't come across it before, led by Stephen Holgate. So Stephen Holgate, every breath we take, it gives a nice review of the evidence. You know, it's written really well. It's got great infographics, so you can understand things. It doesn't use the sort of panic. It uses, you know, explanation, and then it tells you things about what you can do about it in a really nice, approachable way. And I think that's much better. You know, that's a very good example of public health messaging about a chronic threat that's ongoing, that's of concern, but we can do something about it. And we can, as individuals, do something about it. So just going to the last slide. So taking you through a few things from personal perspective here, but initially on the science about how lockdowns might provide some interesting information about changes in transport and air quality. Good science, it does take time. You know, you can get some things out quickly, but some things do take longer to establish your science base. And I've got air pollution here. I think I was going to say about air pollution and COVID on that. So air pollution, COVID, we're still working on that. It's likely to have a role. It's nowhere near the impact of vaccinations and other policies, but it may become important when you know, we've got to the level of vaccination that we stick at, and it may be something that we could look at again. I think there's something really important about the public health messaging, and we do need to remember that public health is global. It's not just our local areas, but it has a regional and international perspective as well. Thank you.
Thank you very much. A round of applause. Thank you. Thank you very much for a very careful and balanced view on the situation, the relationship between air pollution and COVID. A lot of there for us to think about. Now, bearing in mind this is a hybrid conference, we will be fielding questions from people online in addition to the people in the room. But if we could perhaps start with questions in the room, I will bring the microphone to you. If you could just identify yourself and clearly pose your question to Anna. First question, please. Get over there.
Thank you for such a helpful talk. My question is whether you think that the hoary old concept of herd immunity is one of the casualties of the epidemic, or whether it still has some validity and can be a relevant basis for policy.
I think it got a bad press is the answer, herd immunity. I have to say I was very reassured a few months ago when it was one of the ONS surveys which showed that 93% of the adult population had antibodies. So that tells you that you have a degree of protection in the population, you know, however they've acquired them via vaccination or infection. So, I mean, it remains a very helpful concept. I think applying it to COVID is tricky because of the variants, and that's been one of the big problems. And the second issue is about how the vaccines work. So they're not sterilizing vaccines, they are protective against severe disease, but not necessarily against infection. And they're not 100% effective in everybody. So there are some people who they're not working in. So I don't have a problem with herd immunity, but I think it's in that sort of febrile time that we had last year when it first came up, it really, we stopped having any rational discussion about it.
We have some online questions, so John will read them to you.
Yes, well, thank you, Chris. Just one online question here. The question about ambient and indoor. that many of these studies seem to focus on the ambient environment, but what about exposure in the indoor environment? Is this likely to show a stronger association with subsequent COVID mortality than the ambient measures?
That's really important. So it's been brought up quite a lot in this context because people have been spending a lot more time indoors and because the transmission is much more likely to happen indoors. So the first thing is to say there is infiltration of outdoor air indoors. And the second is that we don't know enough about indoor air. So there is a very large research program, the Clean Air Challenge Strategic Priorities Framework, and they're concentrating on indoor air, but we don't have anything comparable to the monitoring that we have in outdoor air. And it is extremely variable. And, from the many different types of exposure that you can get indoors. And I'm not sure that we will necessarily be able to answer that question in epidemiological studies, but we could look at it in laboratory studies and look at the types of pollutants that are in indoor air and expose lung cells with viruses. I think that's the way in which we're going to be able to get towards answering that question.
Any more questions? I'm sure.
Just observing the COVID graph post probably June, although it's wavering up and down, the general trend is still upwards. And also coming into winter, we would expect rises in normal air pollution, so NO2 particularly, but also particulates. So without sounding overly pessimistic, we were sort of sleepwalking into a problem this winter because we do seem to have continuing rising cases, and despite a fairly good rollout of the vaccination program, it's clearly not going to be the only thing that removed. It's not going to remove it completely. So I'm just wondering what your thoughts are as to how winter progresses.
Well, that's a good one that a number of modelers have been trying to work on, and I really don't know where we're going to on that graph, because it could stay where it is, it could go down a bit, it could go up. I think it's likely to go up. In terms of the air pollution link, well, I think the important thing, you don't have to worry about the air pollution effect on COVID unless you've got the COVID. So the most important thing is the spread of the virus. And we may end up going back to formalising working from home and wearing masks if the rates continue to go up. I can't really predict what the government will do. It's not going to look like last year. It's not going to look like last year in terms of the deaths and hospitalizations, because we do have vaccination and the vaccinations are protective, and we do have booster jabs that are rolling out. So I feel much more optimistic. I sort of think of it, last year it felt dangerous and this year it feels disruptive. So I think that's the difference for me between last year and this year.
Sure. Hi, thanks. I've already got the microphone. Sarah Legg, I'm chair of the Air Quality Committee for Environmental Protection UK. It's really what's been really interesting from my point of view, from an air quality point of view, is that we've been able to test a lot of things that people have said, no, it's way too radical. Big reductions in transport, big reductions in commuting, a big boost in video conferencing and all of those things. So it's been really interesting, and it's one small silver lining to all of this. One thing that strikes me, and it's really quite a wide-ranging question, is in this rush back to normalcy and things, obviously we don't want to rush back to some aspects of that. And from your point of view, kind of talking to us as environmental people, what advice do you have in helping to kind of really embed some of those more sustainable behaviours in terms of kind of building that into the public health messaging and building that into the environmental messaging?
Okay, I think the first thing is to really understand what's going on in your local area, and talk to people and get their opinions. But certainly within our own institution at the university, people are happy with remote workings at least some of the time. Some of them want to be in the office, some of them need to be in the laboratory, for example. But actually a lot of the staff are happy doing a lot more working from home than they did before. So I think just from looking how things, just traveling around at the moment, that's not just University of Leicester, that's across wide sectors of the population. So I think that's important about the home working and video conferencing. I think what we need to look at very carefully is public transport and getting people back onto public transport. And we also need to look at ventilation more closely so that people feel safe, because people said, oh yes, ventilation, and then nobody seems to have really looked at it in any systematic way. So I think that's important. And I think just coming back to the idea that, yes, of course, we can change things. We can be flexible. You get in a mindset that thinks that things can't change, or you can only change them a little tiny bit. And I think maybe reminding people that, the world turned upside down and changed, and we still, continued, is quite important. And to make the most of that in terms of saying we can look at things in a different light.
There's one more question over here.
Yeah, thank you. I was just wondering, so in terms of the link between air pollution and COVID, is it, when people ask, what is the most likely link, from your conclusions at the end there, is it fair to say that we don't know about the transmission, but if you do catch COVID, the air pollution would predispose some people to have a more severe COVID impact of COVID? Is that it's just how do we?
Nearly, I'd make that a bit long. I mean, air pollution increases your risk of chronic disease. So you're reducing air pollution in the long term reduces the risk of having a more severe COVID COVID disease. Whether it's the idea of it being spread about on the particles, I don't think is likely to stand up. The issue of whether it affects infection is still under investigation. So it might do, or it might just not be so important given all the other factors about your immunity and the vaccines and which variant you've got. So I would sit on the fence about that one. So I would say that air pollution potentially gives you more severe disease, but it may be because of the long-term effects of air pollution. And I'm still a bit cautious about the short-term effects and need to see some more evidence on that, because even if this upregulation of the receptors that the virus binds to, even that might not be enough to alter the subsequent cause of the disease. It might be an interesting mechanism, but it may not be actually very important in the course of an infection. I can't tell yet.
So it would be fair to say that if we reduce air pollution, then the severity of COVID on some people would decrease a bit.
Yes, I can't give you a number on that, but it looks likely that that would be the case. Yeah, much as you would say something similar for COPD and heart disease.
Of course, we're all aware of the tragic death of Kesey Deborah,
yeah.
And Professor Stephen Holgate gave expert evidence at the reopened inquest. And of course, that's the first time that there has been established a link between poor air quality and actual health impacts. And I think there's more to that, isn't it? That's just the coroner making a statement, isn't it? Mm-hmm. I think that Stephen Holgate has said there's more to be done. And of course, that's why he is so concerned about it as the clean air champion, that we need to drive down air pollution.
Yeah, that was a very significant ruling. And one of the issues I think it's highlighted is, you tend to think, if you're an epidemiologist, you think about, increase in risk as an average across a population. But actually, for individuals, there are some individuals who are going to be incredibly sensitive to the effects of air pollution. And I think that ruling was very useful in unpicking the evidence and looking at that in a specific individual. So, very sad outcome, but it hopefully will lead to some changes in policy and the way that we think about air pollution and individuals.
Thank you. Chance for one more question, unless yes. John, could I ask you, we've got any online questions? You've got one to come. It's okay.
Sorry, being a bit cheeky with the second question. It was very interesting to see all the complications in identifying a connection between air pollution and COVID impacts. My question is, I realise it's probably too early for this, but are there plans to look at the correlations between long COVID, which seems to have different driving factors and different physiological issues with air pollution?
I have a PhD studentship advertised at the moment, so if anyone knows someone who's got good quantitative skills, but yeah, so I haven't seen very much talked about on this, but it's certainly something that I'm quite interested in taking forward, because people who have recovered from COVID may be more susceptible to environmental stresses. So I think that's an interesting area to take forward. Yeah, I agree.
Yes, thank you. There's another question that's appeared on our Zoom feed. And the question is that although it seems that impacts at an individual level may be quite small, there may be significant impact on health institutions, hospitals and so forth, of even quite small increases in demand driven by the increase in the individual risks. And doesn't that really make it more of a case for challenging air pollution as a way of protecting the health services themselves?
Yeah, I will go back to what I said at the beginning. So my opinion's of individual on this. It's not an official opinion yet that air pollution increases the risk of COVID hospitalization, and it's certainly not quantified. So, some scientists are more cautious about this and say that we need more evidence, and it's not something I think you could go out and say we've got to reduce the air pollution to reduce the pressure on the hospitals. I don't think we're at that stage. And as I said previously, you don't need to worry about the air pollution and the COVID if you haven't got the COVID, high rates of the COVID, or not that you don't need to worry about it, but it's not a public health issue if you've managed to keep the COVID rates down. So I don't think we're quite at the evidence base that we can campaign on this, but it's certainly, we can say that air pollution, we know affects chronic disease, and that increases the risk of more severe COVID. That's something I'm fairly secure on. The quantification is going to be important now, I think, if you're taking it forward, because people will say, why do we need to spend time on this, or should we be spending time on trying to get people having booster jabs? And that might be the more effective solution in the short term than reducing the air pollution, whereas air pollution remains an important medium and long-term imperative.
Well, thank you very much. I think we're going to end the session slightly early there, but thank you. I'm sorry, have we got somebody else?
Yes.
I'll come over to you. Last question, thank you.
Thanks. Oksana Waitiel, Transport Research Laboratory. My question is about the indoor air quality, about cleaning of the indoor surfaces and areas, public areas or communal areas, and link it to the effects of COVID and air quality, indoor air quality. Would you have any opinion on that? Do we have any studies? Because I haven't really come across of anything, because I know that lots of cleaning materials associated with the levels of PM 2.5 indoor, and so it's clearly associated with the public health. Yeah.
No, I've the same issue. I'm not aware of any studies on that, but it's a very good point. And, you know, it's not just things like the PM 2.5, but you've got the volatile organic compounds coming off. You don't know what they're doing. I haven't seen anything on cleaning. Most of the studies are around things like hand hygiene and surfaces in terms of virus virus passing on the virus. So which seem to be important. If you've got someone with COVID in your household, it's important to keep washing your hands, because that seems to be linked with transmission. So it's not just the air, the air. It's yeah.
So they are increasing some that's within inside of the room.
Yeah.
Would it increase the transmission of the disease?
I don't think there's any evidence on that. I haven't seen anything in terms of the indoor air. And again, it's something that I think you would want to look at in an experimental setting, and it would be very hard to study in individuals. It would be an experimental study to do. Yeah.
And just one last question from the online feed from Nathan Gray. He asks if you're considering the effect of inequality in air pollution exposure as a driving factor for the health inequalities associated with COVID.
Yeah, I think that's also really important. And most of the studies to date have adjusted for it rather than look at it as interaction. And I think there's some more work that needs to be done looking at the interaction of vulnerability. So that's really important. I agree.
Okay, that really does end the session, and that has been really tremendous. And thank you once again for the keynote speech. It set the tone for the conference,